take a few minutes and talk about a project that In From the Cold and I and some other partners worked on last year. Share some of the information that we learned from that study, and talk a little bit about the big question for me, which is always, so what? So what does it mean? What do we do about it? What are the implications? Like Diana, I 1000% believe that we are in exactly the right city to end homelessness for everyone, but in particular for families. And so this is a big passion of mine, and I'm really excited to be a part of. This is my research work, but also the collaborations that I get to do with many community-based organizations, including In From the Cold. So really quickly, I just want to talk about the way this project came to be, how we took it up, what we learned in our findings, and like I said, the implications specifically around policy and practice. Let's try to build in an advisory committee, recognizing that I am not an expert in service delivery and policy. I'm not an expert in frontline. I'm not an expert in homelessness. I am one person who is part of a team, and we need the expertise of people with lived experience and people like organizations from the cold that live and breathe this work every day. And so that advisory, and YWCA as well. We had a representative from Alberta Human Services, which I also like to do because when it comes to the so what and what are the implications, having some decision makers in the room throughout helps us sort of translate what we learn into actionable things down the road. So we engaged in a participatory approach. I've already talked about our community partners and our advisory committee a little bit. We had some students from U of C who helped us on this project. We also engaged a group of mothers living in a housing program, Journey House, from In From the Cold, to be our advisory committee from their perspectives. And so we met with them a few times to share what we were learning, to gather their feedback, to help us think about the implications and what all of this means in the real world. We did one-on-one interviews with 15 moms who were in shelter at In From the Cold and YWCA. We also did a qualitative group interview with frontline service providers to help us again think through what are the implications of what we're learning. And so we knew a few things going into this project, which is primarily why we wanted to do it in the first place. We knew that most families experiencing homelessness are headed by single moms. We know that families were staying longer in emergency shelters than adult singles stay in shelter. We know that the cultural backgrounds of families are very different than in our adult single shelters, primarily Indigenous families and newcomers to Canada in our family shelters, and primarily, although Indigenous people are overrepresented in our adult shelters as well, but primarily Caucasian adult singles in our adult shelters. And we also knew that a primary pathway into homelessness for all families is violence. We had some assumptions going in about what that violence looked like, meant, felt like, and we were really challenged about what we knew when we talked to these moms and learned exactly what those experiences were. So that was a big learning for us, which I'll talk about in a moment. So just some key themes from what we heard from the moms. What we didn't anticipate was that almost every mom that came forward was a newcomer, some refugee moms and some immigrant moms. And so we learned a lot about the structural barriers associated with family homelessness. And those are primarily due to big structural gaps between our immigration policies, our housing policies, our income support policies, which really make the majority, particularly of refugee families, completely ineligible for all social services that most Canadians are eligible for. And so those structural barriers caused a lot of issues in terms of being able to access supports other than supports that are available in shelters. Lots of issues around eligibility, which I've talked about. Childcare is no surprise to anybody in this room, is a huge barrier for families trying to exit homelessness, sustain housing, prevent future homelessness. And always, and in every conversation in homelessness, we need to talk about housing, the lack of affordable, safe, appropriate housing in our city. Another barrier that a lot of the moms talked about were social barriers, and to them, this meant difficulty sustaining healthy relationships, strong social support networks, people they could rely on in times of crisis, or even for an ear or a friend to share stories and experiences with. So that was a big barrier for a lot of these families. And emotional barriers for these moms really were about their feelings in terms of what it felt like to experience homelessness, many of whom had very different ideas about what life would look like when they came to Canada. the promises that were made to them in terms of the supports they would have access to, the life they would be able to realize upon coming here. They struggled a lot with what that felt like in terms of being denied in their minds access to those things. And finally, our final barrier was informational, and so this was explained to us as really big misunderstandings in terms of where to go for support, what kinds of supports they could access, inconsistencies in what they heard, big gaps between who they needed to speak to around their immigration issues and who they needed to speak to around housing and healthcare in particular. Lots of families weren't, at least felt they weren't eligible for Alberta healthcare cards, and so felt they were denied access to universal healthcare. So big issues around lack of awareness and inconsistency of information. And so some of the themes, barriers was a big theme, but really we were interested in understanding the stories of these moms, what they've experienced, and what they can teach us about how to do something differently. And so conceptualizations of violence, I referred to this a little bit already, but all of the women that we interviewed had experienced violence, many of them across their lifespan in different ways and forms and by multiple different abusers. And so interpersonal violence in terms of relationship violence, structural violence, many of the moms talked about coming from countries in the world where their experience with people in authority and positions of power abusing them in their homes, their families. One mom told us that every month government officials would come to her home, line the family up, and beat up the men in front of the family, thinking that this would force them to obey and comply. Familial violence, so growing up in homes where there were violence, and like I said, multiple abusers. And so this is a very complex experience of violence for many of these moms. And when we think about how we deal or respond as service providers, that's really important to understand. So the cultural complexities, I've talked about this a little bit, but a lot of the moms, because they were fleeing violence, left their situation without papers, felt that their abuser was holding their papers over them as a form of power to keep them in the home. And so when they left, they had no way to prove what they were eligible for, what they could access, and so their only option was emergency shelter. Changes in status, many had lost their sponsorship for various reasons. The complex systems we've already talked about, being trapped between all of these systems, which typically don't work that well together, particularly when you bring in the immigration issues, and lack of appropriate support specifically to deal with cultural differences. Children was a huge theme. This is not a surprise again, given that these are moms who have their kids with them, many of whom have lost kids to systems, but many who still have their kids in shelter. The driving force behind their homelessness in some cases was their kids, but it was also the reason they could put one foot in front of the other and keep going every day, wanting a better life for their kids. So kids around keeping the fears of their safety, not wanting their kids to identify homelessness as a normal experience or a typical experience, really wanting to challenge that sort of idea of this is not the way life should be, nor it needs to be moving forward. The systems piece was huge. The biggest systems for these families, not surprisingly, child welfare, the income support system and the housing system, and the gaps between those systems. And finally, I think, and particularly important for today, most of the women, all of the women actually that we met with, had this just really intense sense and feeling of hope that this wasn't the way life was going to be, that it could be better, that it would be better, and that their hopes and dreams and the needs of their kids fundamentally come first, and sort of were what drove them every day to look for solutions and to try to make things better. So when we met with the staff and when we met with our advisory committee of moms, we shared these results, we told them what we were hearing, and we really challenged them to think about what are some of the things that we need to do differently. And my hope is that the next steps for this will be to work with the family subgroup of the Recovery Services Task Force to try and take up some really tangible policy asks and challenges that we can move forward collectively on. And so a big theme was interagency collaboration and timing. And so a lot of moms talked about being able to find a house but not being able to get their income support damage deposit in time, and so they lost the house, and vice versa. And so big gaps in terms of the timing of when they were ready, when they could go, and when they could have access to the services that they needed. Short-term housing for stabilization came up as a big theme, and I'm glad that Diana alluded to this morning already, because I think housing first is a practice that works for a lot of people. But when we talk about kids and needing stability and safety in a place where they aren't in fear of abuse, transitional housing can be a really good solution. So giving them an opportunity to be safe, to feel safe, before moving into scattered site or out of an apartment on their own where they may not have those same kinds of safety pieces in place. So as part of the continuum, though, right? So as Diana said, this is one piece of a larger continuum of the housing and supports that we need. Flexible and mobile funding was an interesting idea, I thought, in terms... I'm almost done. So recognizing that sometimes a family may need intensive supports right away, but they may not need those intensive supports forever and ever, but they might always need affordable housing. So is there a way that funding can follow parents or moms and families so that they can sustain housing in the market with a rent supplement without having to be attached to a particular program or needing case management? Always talk about the increased stock of affordable housing. We know we have a crisis in this city. We know there's lots of good things happening, but we're still really, really far behind in terms of what we need. And finally, their suggestion, especially the moms, was agencies need to take a look at their eligibility criteria and not be so trapped by what funders expect them to do or what government expects them to do, but as experts recognize the role that they can play in individualizing their criteria in order to support families with what they actually need. So really quickly, some next steps. We do have a follow-up study that we are doing within From the Cold specifically around this immigration issue. So we're coming at this as this is a structural problem, it's a policy problem. We, I think, are really obsessed with fixing people and solving individual problems. My critical view is that it's actually our systems that are broken and our policies that are causing these gaps and barriers and creating most of the issues. So we're going to take a look at the legislation and policy specific to immigration, specific to housing access, specific to healthcare, and try and figure out where those gaps in policy are, particularly for newcomer moms. We also just submitted an application for a study on Indigenous family homelessness, and we have in From the Cold and Canadian Observatory on Homelessness, Aboriginal Standing Committee on Housing and Homelessness, and Dr. Rita Henderson and I from UC. I'm not sure if Rita has engaged Dr. Croshu yet, but we fully intend to invite you to be a very important part of that conversation as well. So that's it, basically. I think the important message from my perspective as a researcher is that this is part of a process, that research is really important, but more importantly is the implications and the so what of research. So if we can work with our community partners to try and advance some of these changes to public policy that make things a little bit better, integrated systems, more streamlined access to supports, I think will have a huge impact on our families. Thank you.